What happens to your body after you die? There's no denying it. We shall all pass away at some point. The natural process that follows is intriguing, if terrifying. Your body starts to progressively deteriorate the moment your heart stops beating if preservation methods like embalming or mummification are not used. Your brain activity spikes just before you pass away, then stops. Illustration of a brain with electric arcs to the left and right. Researchers who monitored the dying patient's brainwaves discovered that the brain becomes more active just after the body expires. This may provide some explanation for why people with near-death experiences recall their life flashing before their eyes. The body temperature drops. The brain is in charge of regulating body temperature. The body's temperature will begin to decline as this organ ceases functioning and will eventually reach room temperature. The body's fat content, clothing worn, and the outside temperature all influence how quickly this occurs. The body, however, cools off by an average of 1 to 2 days per hour. The first of the early post-mortem alterations, known as algor mortis, is used by forensic specialists to establish the time of death. Within minutes, cells in the body start breaking down. To survive, cells require oxygen. The interior of the cell becomes extremely acidic in the absence of blood moving through the body to remove carbon dioxide. Due to the breakdown of compartments caused by this, previously held harmful substances are released from the cells. These consume the cell inside. This is known as autolysis. Autolysis may stop in extremely cold temperatures, protecting organs from potentially fatal harm. This explains why cooling down the body during operations or after heart attacks can save lives and why people can be saved after drowning in cold water for up to 40 minutes. Every muscle in your body relaxes, so you may poop or pee. The body's muscles, especially the sphincters that prevent internal organs from seeping out, relax just before death. In other words, although it can be upsetting for families present at a deathbed, it's perfectly normal for some bodies to poop or pee occasionally. When that occurs, a medical expert could ask the family to leave the room so they can clean up the body. Within hours, blood is pulled downwards, causing splotches on the skin. The heart begins to be pushed down by gravity since it is no longer pumping blood throughout the body. Within 30 minutes following death, patches start to form on the skin as the blood pools. These patches coalesce about 2 to 4 hours after death, resulting in substantial dark purplish areas towards the body's bottom and lighter skin elsewhere. For people with darker skin, this might be less obvious. Rigor mortis is the name of this process. Rigor mortis sets in. After dying, the body is flexible and limp. However, as the body degrades, the muscles accumulate substances like calcium and lactic acid, which are responsible for exercise cramp. This causes the muscles to tighten up and bind together, locking them in place. Within 3 to 4 hours of death, this process begins in the hands and spreads to other parts of the body within 12 hours. Within 36 hours, the muscle cells generally start breaking down and the body goes limp again. The nails seem to be growing because the skin is shrinking. Although it may appear that the hair and nails continue to grow after death, this is fiction. In actuality, the skin dries out and becomes more fragile shortly after death. It causes the nails and hair to appear longer as it shrinks. You smell terrible. After death, the corpse begins to decompose, although the physical symptoms don't show up until much later. At that point, the body produces putrescine and cadaverin, 2 compounds with unpleasant scents. Microbes accelerate the decomposition. Microbes that are already present in your body go into a feeding frenzy as a result of the chemicals released by the cells as they autolyze. Whether it's the skin, the stomach, or any other area that is exposed to the air, the body is often effective at keeping germs in check. However, when the body has passed away, bacteria, fungi, and other organisms escape and begin to multiply. Microbes give your skin a greenish hue. Around 18 hours after death, this causes the skin to take on a greenish tint, beginning around the belly. Due to the gas and fluids that the microorganisms release into the body, several bodily parts also begin to expand. Hair starts falling out. The skin begins to loosen a little bit after bloating. The surface develops black patches and hair begins to come out. Within 24 to 48 hours of a person's passing, that begins to occur. Insects come to finish the job. Insects like blowflies and flush flies are drawn to the smell of the body and will deposit their eggs in the remains if they are left outside. The maggots eat any leftover tissue as they emerge from the eggs, cleansing the bones. This step of the putrefaction process allows for the survival of hair and cartilage. Eventually, all that will be left is a pile of bone. In many instances, the body will continue to deteriorate until just the bones are left. It is known as the skeletonization phase. All bodies do not skeletonize. Some may partially or entirely mummify, meaning the skin and possibly some interior tissue will remain preserved depending on the circumstances and usually in very cold or very hot settings. Every body is unique and everybody will disintegrate a little bit differently. However, everyone will eventually have to deal with death at some point or another.